In this video, I will teach you everything you need to know about the benefits, contraindications, and uses of artichokes. And I predict that by the end of the video, you will be surprised by at least one of its effects. Health benefits of artichokes and how to use them. Hi, I'm Dr. Manu, and this channel is all about health and wellness. I help you by providing certified scientific information in a simple and cohesive way. Now, let's dive right in. What are artichokes, and why are they good for you? Artichokes are a type of vegetable that belongs to the thistle family. They are native to the Mediterranean region, and they have been eaten by humans for centuries. A cooked medium-sized artichoke of 120 grams alone contains excellent sources of vitamin C, 10% of the RDI, vitamin K, 15% of the RDI, vitamin B9, which is folic acid, 17% of the RDI, magnesium, 13% of the RDI, and also antioxidants with an astounding 84% of the RDA. Artichokes are also a good source of other nutrients, such as phosphorus, 13% of the RDI, potassium, 8% of the RDI, zinc, 5% of the RDI, calcium, 3% of the RDI, iron, 9.15% of the RDI, vitamin B6, 8% of the RDI, vitamin B3, 9% of the RDI, vitamin B2, 8.23% of the RDI, vitamin B1, 5% of the RDI, vitamin B5, 6% of the RDI, and a nice 6.84 grams of vegetable fiber. 18% of the minimum recommended amount per day. Yes, dietary fiber is, as a whole, a nutrient. Considering that today's health professionals strongly recommend a low-fat, low-processed, and low-added sodium diet, with at least 5 servings of fruits and vegetables a day to reduce the risk of many diseases like heart disease, certain types of cancers, obesity, and diabetes. Artichokes are a perfect fit if you want a delicious food for a healthy lifestyle. Artichokes are low in calories, do not contain saturated fats and trans fats, are low in sodium, and do not contain cholesterol. Finish with the list of nutrients to consider in particular. For each medium-sized artichoke, there are about 4 grams of protein, which for a vegetable is substantial and above average. Specific benefits regarding established health problems. The scientific studies carried out so far on artichokes and artichoke extracts have shown several benefits. Artichokes may lower bad LDL cholesterol, lower triglycerides, and increase good HDL cholesterol. But how much can it help? A study that involved 143 adults with high cholesterol found that taking artichoke leaf extract for 6 weeks resulted in an 18.5% and 22.9% decrease in total and bad LDL cholesterol respectively. Artichoke extract reduces dangerous high cholesterol levels in 2 main ways. Through the component called luteolin, an antioxidant that prevents cholesterol formation, and thanks to the optimizing effect it produces, which enables your body to process cholesterol more efficiently, thus leading to a lowering of dangerous cholesterol levels. Artichokes may help regulate blood pressure. For example, one study has shown that subjects with high blood pressure taking artichoke extract experienced an average reduction in both diastolic and systolic blood pressure of 2.76 and 2.85 millimeters of mercury respectively after 12 weeks. Despite not being fully understood, how artichoke extract reduces blood pressure is believed to be through promoting the enzyme ENOS, which in turn widens blood vessels. This has been shown via both test tube and animal studies. Artichokes, as we said earlier, are also a good source of potassium, which helps regulate blood pressure. Artichokes may improve liver health, protect your liver from damage, and promote the growth of new healthy tissue. It also increases the production of bile, which helps remove harmful toxins from your liver. In a trial of 100 people with non-alcoholic fatty liver disease, taking artichoke extract for 2 months showed improved liver function. Another study of obese adults with non-alcoholic fatty liver disease has shown that consuming artichoke extract over a 2-month period reduces levels of liver inflammation and fat deposition significantly compared to the placebo group. Scientists believe that cyanurins and silymarin, 2 antioxidants found in artichokes, are partly responsible for these benefits. Artichokes may improve digestive health. Being a great source of fiber, they can help keep your digestive system healthy by promoting friendly gut bacteria, reducing your risk of certain bowel cancers, and alleviating constipation and diarrhea. Containing both probiotics and probiotics, they influence the composition of the gastrointestinal microbiota, improving the immune response, digestion, and absorption of nutrients. Having the proper types of gut microflora is essential for inhibiting pathogenic bacteria growth. Artichoke contains one of the most effective probiotics, inulin. In one study, 12 adults experienced an improvement in gut bacteria when they consumed an artichoke extract containing inulin for 3 weeks. Artichoke extract may also provide relief from symptoms of indigestion, such as bloating, nausea, and heartburn. Conducted on 247 people with indigestion, indicated that taking artichoke leaf extract for 6 weeks reduced symptoms, such as flatulence and uncomfortable feelings of fullness, compared with those who didn't take it. Cynurin, a compound found in artichokes, may cause these positive effects by stimulating bile production, accelerating gut movement, and improving the digestion of certain fats. People who incorporate more fiber into their meals generally report feeling more satiated and eat less. Inulin, mentioned earlier, appears to have additional benefits in terms of healthier body weight. Researchers found that daily probiotic consumption reduces appetite, lowers body fat mass, and improves glucose tolerance. Artichokes may ease symptoms of irritable bowel syndrome. IBS is a condition that affects your digestive system and can cause stomach pain, cramping, diarrhea, bloating, constipation, and flatulence. In a study on people with IBS, 6 weeks of daily intake of artichoke extract significantly eased their symptoms. 96% of participants rated the extract just as effective as, if not better than other IBS treatments, such as antidiarrheals and laxatives, without having the side effects of those drugs. Another study involved 208 people with IBS, in which 1 or 2 capsules of artichoke leaf extract were consumed daily for 2 months, with results showing a 26% decrease in symptom severity and 20% improvement in quality of life. Certain compounds in artichokes have antispasmodic properties. This means that they can help stop muscle spasms common in IBS, balance gut bacteria, and reduce inflammation. Artichokes may help lower blood sugar. One study found that consuming kidney bean and artichoke extract for 2 months can lower the levels of fasting blood sugar in overweight adults. Another study has shown that eating artichokes at a meal can help control blood sugar and insulin levels. This effect was only seen in adults who did not have metabolic syndrome. Artichoke extract has been shown to slow the activity of a starch-breaking enzyme, alpha-glucosidase. This can reduce blood sugar, potentially impacting its peak. Scientists believe that healthy gut bacteria, promoted by artichokes, may play a role in reducing the risk of insulin resistance, which leads to type 2 diabetes. Artichokes may help against chronic fatigue syndrome. Cornell's researchers found that people with chronic fatigue syndrome had less diversity or different types of bacteria compared to those without it. Low-quality gut flora can lead to many problems, one of which is the disrupted absorption of nutrients, which leads to decreased energy levels, among other things. Since artichokes are a great source of prebiotics and probiotics, they can help combat fatigue and promote increased energy for those who regularly consume them. Artichokes may have anti-cancer effects. Quoting from this study, artichoke is a kind of antioxidant-rich vegetables demonstrated a potential anti-cancer activity on various types of cancer cells related to its content of phenolic compounds. But for now, as regards the ability of the artichoke to fight the growth of cancer, the experiments are limited to animal and test tube studies. Certain antioxidants found in artichokes are thought to be responsible for the anti-cancer effects. These include rutin, quercetin, silymarin, and gallic acid. For example, a study found that silymarin helped prevent and treat skin cancer in animal and test tube studies. Even if specifically there are no studies aimed only at artichokes on humans regarding cancer, some compounds it contains, including the flavonoid apigenin, are widely studied. Citing from this study, abundant evidence speculates that flavonoids may be helpful in the reduction of cancer risk simply by functioning as antioxidants and eliminating free radicals that have been linked to DNA damage and inflammation. Artichokes can help treat allergies, as they are an excellent source of folate and other anti-inflammatory agents. Researchers have found them to be potentially beneficial in reducing inflammation that causes allergies and asthma. Furthermore, being high in polyphenols, they help regulate the immune response. From this study, I quote, "Polyphenols are compounds with various potential biological properties such as antioxidants, anti-inflammatory, antineoplastic, anti-aging, cardioprotective, anti-cancer, and antimicrobial properties." Artichoke side effects and risks. Consuming artichokes is considered safe unless there is an allergy to it. Special attention should also be given if you suffer from bile duct obstruction or gallstones. Anyone with these conditions should avoid artichokes and artichoke extract due to their ability to promote bile movement. In regard to the artichoke extract, in addition to the precautions listed above, it is also not recommended for pregnant and breastfeeding women because of a lack of safety information. If you are unsure whether you should take artichoke extract, speak with your doctor for advice. How should they be bought? The very best way to buy artichokes, like any other vegetable, is to go to a local farmer, taking seasonal and freshly picked produce. But of course, this is usually not an easily applicable choice. Sometimes when buying in markets and supermarkets, fresh goods are exposed to atmospheric agents and UV rays, reducing their nutritional value. If a product isn't local and in season, buying it frozen isn't as bad a choice as it might seem. Generally speaking, freezing helps to retain the nutrient content of fruit and vegetables. However, some nutrients begin to break down when frozen produce is stored for more than a year. The real problem comes from blanching, which takes place prior to freezing, and involves placing the product in boiling water for a short time, usually a few minutes. This kills any harmful bacteria and prevents the loss of flavor, color, and texture. Yet, it also results in the loss of a part of the water-soluble nutrients, such as B vitamins and vitamin C. Generally, the extent of nutrient losses ranges from 10 to 80%, with averages around 50%. There is some evidence to suggest that frozen produce retains its antioxidant activity. What is the best way to consume artichokes? The raw artichoke preserves better the vitamins it has, but is terribly stringy, hard, and difficult to digest. Furthermore, the quantity taken must necessarily be small. The cooked artichoke, on the other hand, is more tender, more digestible, and incredibly also has a higher quantity of antioxidants than the raw one. Yes, you got it right. Regarding cooking, among all methods, the one that allows you to better preserve the nutrients in vegetables is steaming. In the second place nearby is microwave cooking, while the last places are boiling, grilled cooking, and frying, which is the absolute worst. If you buy it fresh, you need to first cut off the stems, then peel the outer leaves one by one until you get to the tender leaves in the center. If instead you buy it packaged and already cut, then it will be the artichoke heart, and it is ready to be cooked without further preparation. The cost-benefit ratio of artichokes. A principle to follow that allows you to optimize your health is the cost-benefit ratio. More specifically, the cost spent, both in economic terms and in terms of negative effects that it can bring, compared to the nutrients it contains. This is one of the reasons why being informed about food is important. It allows you to decide with greater awareness, counteracting the emotional effect of advertising and disinformation. Confusion does not exist in this dojo, does it? My verdict, as if it wasn't clear yet, is that artichokes are among the foods that are the most worth consuming regularly. If you like this video, don't forget to like, subscribe, and hit the notification bell to stay up to date on new content. Thanks for watching.